Good evening, everyone. Thank you all for joining us tonight. My name is Caitlin Gaskin, and we are here with Dr. Kahler and April Allen for the Look Great at Any Age presentation. Dr. Kahler is a plastic and reconstructive surgeon with West Georgia Center for Plastic Surgery in Carrollton, Georgia. He earned his medical degree from Emory University School of Medicine, and he completed his general surgery training at the Emory University Affiliated Hospital System in Atlanta. He completed a fellowship in plastic and reconstructive surgery at Penn State University Hospital. He has also obtained additional qualifications in endoscopic plastic surgery and laser surgery. April Allen is a board-certified family nurse practitioner. She earned her master's in nursing from the University of Alabama at Birmingham and her bachelor's from the University of West Georgia. April injects fillers and neuromodulators, performs laser skin rejuvenation procedures, and sees post-operative patients. She has previously served as a registered nurse at Tanner Carrollton and Billerica hospitals. Dr. Kahler, you may begin whenever you're ready.
All right, thank you, Caitlin. Welcome, everybody. My name is Dr. Stephen Kahler, as Caitlin discussed. This is April Allen, our nurse practitioner. She's been here with us for about 8 months and is doing a lot of new things in our office. It's great. We'll talk about a lot of them. So our main discussion is going to be how can you look great at any age, because obviously we see all ages in our office. So we're just going to talk about some very basic things like skincare, and then move into some more minimally invasive things like dermal fillers and neurotoxins and other things that you can use to keep looking sharp. So first, we'll just talk a little bit about aging of our skin. And of course, it happens to everybody. Youthful skin is characterized mainly by well-hydrated skin that has, very few wrinkles. I think it's got a nice fullness to it that's firm. And the fullness is largely has to do with the fat content within the face. And as we age, the fat content in the face gets somewhat less. We lose some of the size of the fat compartments in our face. And of course, that makes a big difference in how, in the firmness of our facial skin. Also, as we age, we certainly lose a good bit of volume within our face. We also get underlying bone loss, which can lead to some loss of firmness as well. Certainly, we get less hydration in our facial skin and more wrinkles, and those are the type of things we're trying to correct here. Yeah. Aging is mainly skin aging mainly has two properties associated. There's intrinsic aging, which is associated with the chronologic aging of our skin. So, however old we are, our skin acquires changes over time that are consistent with aging. These are largely genetic. There are telomeres at the end of our chromosomes that get smaller and smaller throughout our lifetime. And when they basically wear out, then cell division is much less likely to happen. So that's also part of the aging process. But the real takeaway here is that intrinsic aging, which is associated with our genes, and time itself, only accounts for about 10% of the aging process in our skin. So it's a pretty small amount overall. The main problem with aging in our skin is extrinsic. It's because of the outside world we live in. It's environmental. So there's a bunch of stuff out in the environment that negatively affect our skin. And probably the main one is the sun. It certainly sends UV exposure to our skin all the time we're outside. There are other sources of UV exposure as well. There are toxins in the air. There are toxins in things that get on our skin. Certainly, there's toxins in pollution. A lot of these are free radicals, which are substances that can negatively affect our DNA and basically attack our DNA and cause some abnormalities in the DNA. And it can also lead to cell death over time. And these are a lot of the big mechanisms that occur to our skin as we live throughout our environment. And in general, our environment with all the stuff in it causes about 90% of the damage to our skin. So it's a big one. And I think the biggest one is sun exposure. If we could, really limit our sun exposure through our lifetime, our skin would be much the better for it. But of course, I think everybody loves the sun. We just have to learn how to deal with it as well as possible. So we'll talk about kind of the first step of kind of keeping your skin youthful. And a good skincare program is what everybody should kind of start out with. So it's the basic system that you'd use to keep your skin healthy. So goals of skincare are basically fairly simple. We want to keep the skin clean, so we use cleansers to do that. We like products that soothe our skin and make it feel soft. We want to restore skin back to its youthful state if there is aging associated in the skin. And that might be, reducing the amount of dead cells on top of the skin, or getting rid of pigment that has accumulated over the time. We certainly want to reinforce these actions that we're taking on the skin to make it better or protect it. And then finally, protection is the big one. And most of the time that means sunscreen. The overall goal of skincare is to keep it in good condition and as youthful as possible. So talking about skincare, I was just going to briefly go over the products that we offer in our office. We do have our own line of products that we have put together, and basically I chose the elements that were in each of the products to get what I think would be a very good result. The main steps in skincare they're fairly simple. The first is a cleanser that will clean your skin, and we basically have two cleansers in our office that we use. The first is just a general cleanser. It's a very gentle cleanser, something that soothes the skin and also has antioxidants in it that will help prevent further damage to the skin. The one thing about cleansers you kind of need to remember is they can be fairly simple, and as long as they're not stressing your skin out, that's probably the most important thing. Because a cleanser is mainly designed just to clean your skin, get the dead cells off your skin, get the dirt off your skin. And it's really going to have a limited amount of actives that you can put at active ingredients that will penetrate the skin, because the cleanser is on your skin for a very short period of time. So people can sell, pretty expensive cleansers out there, but I'm not sure how much they do as far as putting active ingredients on your skin, because most of the time you're simply washing them off at the same time. Another cleanser that we have in our office, and if you look at the products on the screen there, you can see that there's a Radiance Age Defying Cleanser, and this has some alpha hydroxy acids, the fruit acids that can help get rid of the dead cells and flaky skin on the top of your skin. And it kind of thins the superficial surface of the skin out so you can see the normal skin below it. It's also got soothing agents in it that can help soothe the skin and calm down your skin. So it's mainly for aging skin that can be irritated, and it has calming agents and botanicals that will deal with that. I think probably once a week or so, you should use an exfoliator, something that takes the dead cells off the skin and the flaky dead cells off your skin a little more aggressively than just a regular cleanser. Exfoliators usually have some type of physical exfoliator, such as crushed pumice, which is a type of rock product. There's also some stems that can be used as a physical exfoliator, but those are a little more aggressive on the skin and probably should be only used once a week. They're mostly combined with agents that will calm the skin after exfoliation so that you don't irritate it too much. So that's basic cleansing of your skin. The second step is to use a toner that will basically add additional hydration to your skin, and it will also restore the normal pH of your skin. So on the top layer of your skin, there's a layer that's called the acid mantle. So it's made out of different types of proteins and proteoglycans, which are a certain type of molecule that hold together very well. But they also create a bacterial boundary, which can keep the bacterial concentration on our skin down and balanced. And the pH of the skin somewhere between probably 4.5 and 5.5, which is pretty acidic. So that's actually a healthy thing. So I think some toners are a little bit too basic, meaning that they can strip this acid mantle off your skin. So you want to find a toner that has a pH certainly less than 6. I think the one that we have here pictured is has a pH of about 5.6, which should not strip that acid mantle off your skin. But that keeps your skin in balance, and it can help reduce irritation. Toner also adds hydration, and you can use them more than once a day if you want to. But usually it's this, after cleansing, you add hydration to your skin with toner, and then you'll go on to the actives that you'll put on your skin. These are the serums or emulsions that have active ingredients in it. And those active ingredients may be antioxidants, they may be anti-pigment agents, and they may be anti-aging agents like retinol or any other retinoid you might use. But those are medicinals or agents that go through the skin and have beneficial effects on the skin, such as building collagen or getting rid of pigment or protecting your skin from the sun and the environment, such as pollution. And those are antioxidants that do that. The antioxidants are especially important to use during the day because they will help prevent sun damage when you're out. They actually protect your skin against sun damage. And they will also protect your skin against pollution and damage in the atmosphere otherwise. So those will be your actives. You definitely want to put those on before a moisturizer because a moisturizer tends to seal the skin. It seals the hydration within the skin. And so your actives will penetrate more if you don't have your moisturizer on yet. So that's an important point when you're using skincare. After you get your actives in, then it's time to use a moisturizer to kind of seal everything in, seal the hydration in. And usually that contains either some type of silicone agent, which makes it goes on nice and smooth, or some kind of petrolatum agent, which also seals the skin. A lot of people like the silicone because it does seal the skin very well, but it also has a silky feel to it. And so you'll see a lot of products that have some types of silicone in it, either dimethicone or something like that. So the moisturizer is good for you as your last step, generally to seal everything in, keep those actives under the moisturizer, and get them working. And then last but not least, I think the sunscreen goes on last. It's probably the most important step to prevent sun damage, especially if you're out in the sun, because that's the main cause of our skin aging. And just find a sunscreen that works well for you. So as I said, sunscreen is the last but not the least important. It's probably one of the more important things we can do. You can either get a chemical sunscreen, which has certain chemicals that will absorb sunlight and prevent it from being absorbed by your skin. And the other type of sunscreen is basically a mineral sunscreen, which usually contains micronized zinc oxide or titanium dioxide, which usually doesn't have it doesn't leave a color on your skin anymore. So remember that old zinc oxide that used to be white and people would put on their nose, but that's kind of a thing of the past. The modern mineral sunscreens usually are a mix or zinc oxide or mixed with titanium dioxide. They go on quite sheer, and a lot of them are tinted, which makes it really nice too. So I don't think there's any reason not to use it just about all the time. Okay. The last thing I wanted to talk about is kind of a special case because retinoids, which I'm sure most of you have heard of retinol, certainly Retin-A which is also called tretinoin. And there's other synthetic retinoids that are out there that really can have a very strong effect on skin. I think that Retin-A, which is a prescription medication, is definitely a more powerful retinoid than, say, retinol. But there are also are some synthetics that are just as strong as Retin-A and don't quite cause quite as much peeling or redness. But these agents definitely decrease skin wrinkling over time. It's a process that where they enter the cell, the cells on your skin. First of all, there has to be penetration, and then it has to enter the cell. It actually goes into the nucleus, turns on the genes for collagen production, as well as other things. And it just, so you build collagen over time, and this reduces, of course, or reduces wrinkles and reduces the roughness of the skin, because it does thin the epidermis, which tends to get thicker over time. But youthful skin has a very thin epidermis, and it also thickens the dermis, which is the deeper, tough part of our skin that has a lot of collagen in it. So it kind of reverses the aging process that happens to skin microscopically. And then finally, it also has very important effects on pigmentation, because it kind of breaks up pigment and disperses it over a larger area, so you don't get as much individual pigment spots that are noticeable. So I think everyone should at least have some kind of retinoid in their skin care armamentarium, so that would be a good thing to have. So we're mainly talking about how to keep your skin, nice and youthful as long as you can. We just talked about advanced medical skincare, which has a lot of different agents in it that will improve the appearance and the texture of the skin. And so that would just be your first basic treatments to use. But there are other things that we do in the office that are less invasive skincare techniques that we'll talk about here a little bit. So one of the basic non-surgical skincare treatments is neuromodulators. So those are the Botox, or we use a lot of Dysport in our practice. Botox has been around for the longest. It's probably been around for more than 30 years, 25 years. Initially, it was used for people that had spasm of the muscles around their eye. Blepharospasm was called blepharospasm. So they would use that to calm down the muscle. Well, they noticed that when they did this in these people, their wrinkles got better, because the muscle is constantly reinforcing the skin into wrinkles, and then over time, these wrinkles become more permanent. But you can reverse that process by stopping the muscle function that causes the wrinkles and reinforces them, several hundred times a day. So that's the whole idea behind the Botox or the Dysport. So there's quite a few neuromodulators out there. Botox is probably the most common. We use a lot of Dysport because we get a lot of patient rewards associated with our Dysport program. And there's also Xeomin, which is a separate neuromodulator that some people use, and we're not using it in our practice. Jeuveau is a new one that's very similar to Botox. But for the most part, we're using mostly Dysport and Botox as our neuromodulators. So, April, did you want to talk a little bit about this?
I would say that the Botox and the Dysport are very helpful, just to add to what you were saying, are helpful for prevention, and they reduce the development of the really deep wrinkles that are more difficult to treat and usually require more invasive techniques. And so it's great for just as part of your prevention skincare regimen. Yeah.
So as far as how you would use these neuromodulators, they're basically designed to inject the muscles that are most responsible for causing the wrinkles in your skin. So, and they're most useful in the upper half of the face. Mm-hmm. So forehead wrinkles are a big reason we use a lot of neuromodulators like Dysport and Botox. The frontalis muscle, which is a muscle that comes in the front of the forehead here. When we lift our eyebrows, obviously we get these wrinkles that go across horizontally on our eyebrows. But if you can weaken that muscle enough, you can get the muscle function to stop. And you try to allow people to get some eyebrow motion, but not so much that they're going to create a deep wrinkle in their forehead. But once you take that stimulus away, those forehead wrinkles start smoothing out, and it's really quite amazing.
Mhm. And the effects are temporary, so you have to maintain it usually about every 3 to 4 months.
Yeah, so I'd say 3 to 6 months.
Yeah.
So it is what we call a maintenance therapy. It starts working about 2 to 3 days after you inject it. It actually goes into the nerve ending and cuts a protein that's responsible for releasing a neurotransmitter that will make the muscle work. So once that's gone, the muscle does not contract, at least where you put the Botox or Dysport. And over a period of maybe 2 weeks, with the muscle action gone, the wrinkles start smoothing out and they get better and better. And if you have deep wrinkles, it may take, more than one cycle to get those wrinkles to smooth out. But I've had pretty amazing results with it, as far as even some deep wrinkles after 1 or 2 cycles of a neuromodulator will smooth out more than you might expect. Certainly the forehead's a big part to use them. The 11s, which are the
Right here.
basically the vertical lines that go across between the eyebrows, is probably either the most common or the second most common area to treat it. What causes those 11s are 2 little muscles that sit right over the eyebrow, and when they shorten, they cause those vertical lines right between the eyebrows. Well, all you do is target those 2 muscles, and you can pretty much make that muscle function completely stop. And over time, those vertical lines will smooth out. Some people have very deep vertical lines because they've been there so long. So it may take 1 or 2 cycles for those to work out. If they don't smooth out over time, then you could use a dermal filler, which is another agent that is a gel type injection that fills out the wrinkle if you have to. But I'd say it's a minority of patients that require that. The other place that the neuromodulators are very helpful is the crow's feet area. So at the corner of the eye, when you squint, of course, you get the crow's feet. And most of the time they go away when you stop squinting your eyes, but sometimes the wrinkles will persist. So that muscle that is right under there is a circular muscle that goes around the eye. It certainly is responsible for helping us close the eye, so you can't paralyze the whole muscle, but you can knock out the muscle function of the outside portion of it, which is responsible for the crow's feet. So it just takes a little bit of the neuromodulator to knock that muscle out. Generally, you don't use so much that it would travel to any other parts of the face, because we love our other facial expressions. And again, it certainly softens the crow's feet region and can be a very effective treatment for that. As far as the lower portion of the face, I think the indications for use are considerably less than the upper face, but certainly are there. There's a procedure we call lip flip that you can use on the upper lip, and basically the circular muscle around the mouth sometimes flattens the lip and doesn't allow the lip to come out or protrude as much as you'd like it to. It can if you relax the muscle, and you really can't paralyze it completely, because obviously we need that muscle to drink liquids and eat food and things like that. So but you can weaken it enough where it'll allow that tension on the upper lip to release, and it allows the lip to kind of flip out a little bit and gives a much nicer presentation to the edge of the lip. Also, you can use it to treat 2 muscles here called the DAOs. They are responsible for pulling the side of the mouth down. So sometimes people have an appearance where the corners of the mouth seem to dip down. And of course, that makes you look more stern than you want to. People like to have a soft expression on their face. But you can weaken that muscle to help elevate the edge, the corner of the mouth, which is a very pleasing effect. Finally, some people have very strong muscles here. They're called masseter muscles. Sometimes they can protrude more than people like them to, so you can treat those and have them shrink down a bit. But those are the main treatments that we use in our practice for the neuromodulators. There are some specialized treatments, but those are by far the main treatments. So that kind of covered the neuromodulators, which is a big part of our non-surgical treatments. The other big part is dermal filler therapy. So these are injectable gels that can be very helpful to fill out valleys in the face, wrinkles in the face, and add volume to the face. So as I was talking about earlier, when we were discussing what changes occur in the face over time. Well, we do lose fat volume within our face as we age, and you can actually restore some of that with some of these products. We lose skin elasticity, and this can cause some wrinkling, and these agents are very good at filling out wrinkles. And you can plump up things like the lips with these products. So in our practice, we use them for a lot of things, obviously, just those things. But we'll talk about a couple of the more important ones as time goes on. But in our practice, we're mostly using the Restylane brand of products, and there's a wide variety of products within that have different thicknesses and different characteristics as far as stiffness goes. And they're basically designed to use in certain parts of the face. Initially, fillers were fairly simple. There was only a few, and they were kind of brittle. But since that time, they've used different techniques to soften them up, and they have good characteristics for the lips, good characteristics for the cheeks, and depending on how they're manufactured, that they can also last anywhere from 1 to 2 years. So they've increased the durability. We talked about neuromodulators like Botox or Dysport lasting about 3 to 4 months of muscle weakness, and then up to 6 months before maybe you need another treatment, because it takes a little while for the wrinkles to come back. But these generally will stick around for about a year. Most of these fillers are made out of hyaluronic acid, which is a big molecule that lives in our skin. And it can hydrate, it can bind about 1,800 times as much water as the weight of the molecule itself. So it really holds on to a lot of water and is responsible for the plumping of our skin. So these are other forms of hyaluronic acid that inject in the skin, and they maintain that fullness over about a year. Hyaluronic acid in our skin does degrade over time, and as we age, there's less of it in our skin than there used to be when we were young. So this is sort of a replacement therapy. Most of these last about a year, and they do break down over time, but they still hold on to water for a long time. And it takes quite a bit of it has to break down before it releases the water and then kind of disappears. So they're very useful, and we use them in pretty much all areas of the face.
Mm-hmm.
We use them for both wrinkles, and most wrinkles we use are around the mouth. There's lip lines that we can fill. We can fill the lip edge, give a nice little edge on the lip, line it. We can fill the lip itself, upper and lower lips, and it can increase the volume of the lip, especially for people that have very thin lips. You can treat wrinkles almost anywhere on the facial skin. We treat wrinkles around the mouth here, which are called marionette lines. We also treat cheek wrinkles with it, wrinkles that might come along the cheek here. And we treat some issues around the eyes. The main one is the depth of this crease here called the tear trough. And it's something that we can fill fairly deeply because the eyelid skin is quite thin, and you don't want it to show through. But we can fill it fairly deeply and lift that up. Finally, so that's actually volumizing that area. Other areas that we routinely volumize are the cheeks and the lips. So they make some quite thick fillers that are used for the cheeks, especially out here. So increase the cheek fullness. That also helps support the lower face and can actually make the lower face a little better as far as jowl formation. And these are very useful techniques, and techniques we commonly use in our office every week. April, anything else you'd like to add?
I think that's great.
Okay,
Yeah.
April's doing all this stuff too, so I'm kind of hogging the picture here, but. Okay, so that pretty much covers our non-invasives as far as Botox and Dysport and our dermal fillers. One thing I didn't talk about of the dermal fillers is there are other types of fillers as well as hyaluronic acid. Different than the Restylane and Juvederm. There's products that are made out of calcium hydroxyapatite, which is a longer lasting substance that can be injected. It's called Radiesse. We use that for very specialized things, usually on the dorsum of the nose, if we want to try and camouflage an issue on the dorsum of the nose. There's other things like Sculptra, which is it's called polyallactic acid, which is a substance that will actually get surrounded by some tissue in your skin that will maintain volume for a pretty long time. And it's something that takes a little bit longer to appreciate. So these fillers are immediate. You immediately see the wrinkles get better. You immediately see the volume show up. Whereas Sculptra, it can take a little while for that volume to show up. But it's also used to volumize the cheeks and other areas. So skipped over that, but we got to it eventually. Finally, we'll talk about some of the other minimally invasive treatments we use in our office. So I guess it's been almost a couple of years since we've gotten a product called Body Tight or the Face Tight device. And it's made by InMode, and it's basically a radio frequency energy device that can deliver energy to the skin and the fat beneath the skin. So the concept behind this treatment is that there are, and I'll just show you.
Yeah. Body types down there.
Yeah. So the Morpheus 8 is basically a handheld device that has a treatment tip on the device. In this treatment tip are actually 24 little pins that come out varying lengths that go into the skin and then heat the deep layer of the skin. So the reason they deliver that energy to the deep layer of the skin is because that can turn on collagen formation. So it's kind of like microneedling on steroids, because you're not only just making little holes in the skin, which cause remodeling of the collagen, but it also stimulates new collagen formation, which has been quite effective at helping people smooth their skin who have fine wrinkles, and it's been a nice device for that.
Yeah, great results.
Yeah, we've seen some really good results with it. So been very pleased with that. Although the manufacturer said you can repeat it every 6 to 8 weeks if you want to. But I think it makes a little more sense to see what your peak result is and then add to it later. So that's the Morpheus. It's an in-office treatment. Generally, we use a topical local anesthetic that we put on our skin about an hour ahead of time. That is pretty good at numbing up the skin. I wouldn't say it's 100% numb to this treatment, because there are those pins that go through the skin. However, we can numb up areas that are more sensitive if we need to, and at the time of the procedure, and that's more of an injectable numbing agent. So something that's very useful. The treatment takes about 30 to 45 minutes to complete. Most of the time after the treatment, you'll have some, it's almost like a sunburn and a little bit of swelling, but most people, the downtime is, I mean, I had it done once and I was working the next day. Of course, got a mask on, so that's easy. And I would say the downtime is 1 or 2 days before if you have a function to go to or something you really have to be present physically at. And as I said, it takes a while for the effect to occur, but most people see the effect fairly quickly, and then it builds over a period of 6 months. But something that is very easy to do, doesn't take very long, and has a visible improvement in the appearance. For other areas of the face, and actually skin tightening and fat reducing techniques that we use are also part of this InMode device, and it's the Face Tight and Body Tight. So Face Tight is it's a procedure that uses a small wand that goes under the skin. The wand is about the size of an IV. So this is the actual device here. It's got a little wand here that goes under the skin, so you have to make 3 little spots in the skin that it will go under. Obviously, we use local anesthesia to numb up the entire treatment area that we're using, and most of the time we'll use a sedating agent such as nitrous oxide to also make people a bit sleepy for the procedure. But it doesn't have to be done under general anesthesia. It can be done under local anesthesia with maybe a little sedation. So you end up making access incisions underneath the ears and underneath the chin. The advantage to that is you can treat the entire neck, and it's particularly good for people who have a little bit of fat pad in their neck. So in the first picture you see here at the top of the pictures for the Face Tight, you see that she had a little bit of a fat pad on her chin, under her chin, and after the treatment, it's reduced a lot of that fat that was there. It's also sculpted the jawline and makes it a lot more well-defined. So it does that by actually treating the fat as well. So the wand that's on this device will go underneath the skin into the fatty layer. It actually heats up the fat, and the fat lives in these little compartments that are called septae. So it helps melt, it actually melts some of the fat, and it will shrink up the septae. It'll shrink up those little fibrous boxes, and kind of like a shrink wrap. So it shrinks those up, and that leads to some skin tightening over that area. And then once you've treated the fat, you actually heat up the deep layer of the skin. So I was talking about how Morpheus, the pins go in the skin and heat the deep layer of the skin to start collagen production. Well, this does it the same way, but the wand is used to treat the undersurface of the skin and heat it to a certain temperature that turns on collagen production. And it can have a very, very profound effect on that. Mm-hmm. I think it has an even more profound effect on the fat because it does liquefy some of it. And then you just suction that out like as you would liposuction, but it's not quite as aggressive as that as far as having to do liposuction, and get rid of the liquefied fat that's in there. And then usually we have a little bit of downtime associated with this procedure, maybe 5 days. Often we'll use a little sling, an elastic sling that will hold that area in place and press it down so that it sticks down nicely. And the result you see in the first picture, which is the woman with the fat pad and the jawline that's not very, very pronounced in the first picture, and getting rid of that fatty layer and letting all that kind of stick down and show the contour of the jawline and the neckline. These are very achievable results. But I think it is more useful with people that have a little fat in their face. The second picture that you see there in the middle is in the second picture of that example, you see what's underneath that little fat pad and that skin that's kind of relaxed and hanging down. So once you get rid of that fat and let the skin sit down where it's supposed to, you see all that structure underneath, which of course is a much more youthful profile than she had in the first picture. And the same thing in the bottom picture on the left. You can see how much better the contour of the chin is and the contour of the neck is. Obviously, that first picture is a little shadowy, so I don't know about that. Anyway, you can see that it's definitely had a positive effect. In the other pictures, the before and after show that can be used in the upper arms, the same type of device, and a larger device. So this particular handpiece is only about 10 inches long. There's a larger device that's used for the body, the abdomen, the hips, the arms, although sometimes we use the smaller device for the arms, the thighs. You can do the same procedure by heating up the fat, shrinking up the fat septae, and then suctioning out the fat, followed by heating up of the skin. And this leads to not just resolution of the fat, but also skin tightening over time. So this is kind of, I think about it as kind of liposuction on steroids. It's with liposuction, you get about 10 or 11% shrinkage of the skin. So it depends on how good your skin is. If you have a lot of stretch marks, you're not going to get that much. But if your skin's pretty thick and pretty good and without a lot of stretch marks, you're going to get about 11% tightening of the skin. With the body tight and face tight devices, you get about 30 to 35% tightening of the skin. So it makes a big difference in how smooth your skin will be at the end and how fast you get to that endpoint. So for me, it's just a lot more powerful weapon that we have for getting rid of fat and tightening the skin up over the fat without making it too wrinkly or droopy. So those are the main kind of bigger, not minimally invasive treatments that we use in the office. And most of the other treatments that we do are operations that we do in the operating room. So this is the main minimally invasive treatments that we can certainly perform in our office, both efficiently and safely, and something we do commonly. So just want to thank you for joining us today. That's basically what we came here to talk about. And certainly if there are any questions, we're happy to field.
Dr. Kahler, we do have a few questions.
Okay.
Does insurance cover any Botox treatments?
It does if you're using them for migraines, but the Botox treatments that we use are simply for cosmetic purposes, so they're not covered by insurance. There are people that do get migraines associated with muscles that tend to act over nerves that end up with a feedback loop that could cause migraine headaches. But most of those treatments are performed by neurologists, and they're very specific treatment types where they may use Botox in maybe 30 or more areas to relax the muscles that may be causing the nerve irritation that results in a migraine. And it's also a specific type of migraine usually that they have to diagnose in order to make sure it's going to be helpful to you. So incidentally, we see people that where we treat the forehead or we treat the glabellar area, and they say, wow, my headaches are a lot better. But that's not something that we're doing for a medically necessary treatment. But certainly it's available for people that have migraines, and I would urge people to do, if they think they may be helped by Botox, to see a neurologist. But that is not what we do in our office. We're doing mainly cosmetic applications of Botox.
I think we can accept an HSA card
Okay.
too, which can help
Yeah.
for different treatments like that. Mhm.
Right. So that can come out of your kind of medical
Mhm.
health savings account.
All right, the next question is, how painful is Botox?
Well, I mean, certainly it is multiple injections, but it's a very small needle and it only takes a few seconds. So depending on how many areas you're treating, If you're treating just the area between the eyebrows, you could probably do that in 10 or 15 seconds. So it's a very short period of time. It's like any needle stick, but it's a very small needle. It's a 30 gauge needle, which is one of the smallest needles they make. So it's still a needle stick at the end of the day. So it just depends on how much that bothers you. Now, we do have some patients that we use the topical local anesthetics on. So those are numbing agents that, and we have ours formulated by one of the pharmacies here. They make a plasticized gel or liquid gel that basically you can put on the skin an hour ahead of time. It has 24% lidocaine and 7% tetracaine, which are two local anesthetics that are pretty good at penetrating the skin in that vehicle. And so you put it on an hour ahead of time, and it gets rid of the shock of the sting of the needle stick, but it doesn't really obviously penetrate into the deep layers. But I'd say that that's less discomfort in the deep layers than it is on the surface of the skin, which has a lot of nerve endings and of course is very sensitive. So some areas of the face are more sensitive than others. But I'd say there's certainly some discomfort associated with it. If you think it's going to be a bother, then we can certainly give the local anesthetic topical cream. Or if it's even to the point where that's not quite working, you could numb up the areas that you're treating. Now, I used to do that quite a bit, but I did, for the most part, stop. And mainly because it tended to dilute the treatment a little bit. So you're putting in you're injecting a local anesthetic, which is a liquid, and you're adding liquid to that. So it may not make it quite as concentrated to the area you're treating. So it does take some adjustment there. It can also lead to a little more dispersion of the agent, which you don't really want to happen. And it can also lead to more swelling. So I think you're getting the double effect of the liquid volume that's there, and sometimes it definitely causes more swelling. So there's some pros and cons to both of those, but certainly topical.
We use cold packs.
Yeah, we use cold packs, kind of cool the skin down. It achieves two purposes, and it can kind of make it less likely to, or less painful, and it can also decrease the bruising. Okay, hope that was helpful.
Yes, you may have to help me with the pronunciation of this word. The question is there any treatment for Crepey skin?
Crepey skin.
Crepey skin.
So Crepey skin, certainly Crepey skin is skin that's lost a lot of its collagen. It's thinning. I think daily retinoid would be helpful to thicken the skin over time. Certainly as we age more and more, the dermis gets thinner and thinner, and the epidermis gets a little rougher. So the epidermis is the very top layer of the skin. The dermis is the thick, deeper layer of skin. So to reverse that, you can use a retinoid to do that. Now, it's not something that's going to do it overnight. It's fairly slow acting. I say people have to be patient with it. I'd give it 6 months to a year to show a noticeable result. And then maintenance therapy for years can really keep your skin quite smooth. The best skin I've seen in people that, were using are people that have been using retinoids for years. So I've seen some people in their late 60s who have pretty smooth skin just because they've been religiously doing it for the last 25 years. So that in itself over time can be very helpful. I think that the face type procedure is one that can help that. Anything that will build collagen. Some of the skincare products also have peptides in them or other agents that, if they penetrate the skin or when they penetrate the skin, will turn on collagen formation. So basically getting collagen into your skin or getting collagen turned on in your skin is how you deal with crepey skin and wrinkled skin. A lot of people ask about the collagen lysates, which is the powder that you can get or the pills that you can get that has, kind of broken up collagen pieces in it, whether that's effective or not to build collagen. Well, it's still something that's not been studied a lot. So it's not well studied. There's been some small studies done, and some have shown that skin collagen can be increased. And it's mainly because these lysates, which are small sections of the collagen that have been ground up by enzymes, some of those actually have communication abilities in our skin. So some of the peptides we talk about in our skincare products, it may be 3 amino acids that are put together, but they have cellular communication characteristics where they go and present themselves to a cell, say turn on collagen, and it'll turn on collagen. So it's not a stretch to believe that the collagen lysates would do that. So that's one thing we didn't talk about, but it's obviously has been very popularized over the past couple of years, but as usual, it's taking the science a little longer to catch up with it than what people will talk about on social media.
The next question is, are there any non-surgical treatments for under eye bags or wrinkles?
Well, usually under eye bags are caused by a couple of things. Sometimes if you have sinus problems, that can cause swelling that leads to, a purplish discoloration, and it can also lead to swelling of the under eye. Most commonly, the bags under the eyes are from the fat pads around the eye. So our eye is inside a socket, obviously, and it's cushioned by a fat layer around it. So that keeps your eye from bouncing around too much. So the fat layer is necessary. It cushions our eye. However, there are little membranes that hold that fat pad in place. And as we age, those membranes can stretch. And if they stretch, they can bulge. So that's what leads to bulging eyelids, or especially lower eyelids, and usually the upper inner portion of the upper eyelid. You'll notice that as well. So can you treat those with an office procedure? I would say not so easily. Most of the time that's a surgical procedure. So you usually physically have to reduce the fat pad. So most of the time when I'm doing something like that, it's a fairly straightforward surgical procedure that you go on the inside of the lower eyelid. You can open that area, expose the fat pad, remove what's excess, and then obviously there's no more protruding fat. So you take out just enough to where it'll be flat. And then most of the time I combine that with a chemical peel on the outside that will smooth out the skin and tighten the skin, and it leads to a nice smooth result.
Mm-hmm. Now if the bags aren't that big, you might be able to mask it a little bit with some filler.
Yes.
Temporarily.
So we were talking about doing the tear trough here. So usually there's a fullness and then a depth. Mm-hmm. Sometimes you can camouflage it by filling that depth, and then the transition between the eyelid skin and the cheek looks more smooth.
Yeah.
So
in mild cases.
Yeah, that would be mild protrusion of the fat pads. There have been people, and I don't know that they're in this country, but there have been people that have used Kybella for that purpose, but it's an off-label use, and I would not recommend it because there's a lot of things around the eye you don't want to negatively affect. So I've seen at least one article that talked about that, but not something that's in general use. Kybella is usually a fat dissolver that is used underneath the chin. So, and it's usually requires more than one treatment to get to the end point. But that would be the only thing, I think. You don't want to do anything too invasive around the eye that you're not controlling very well in a surgical environment.
All right. The next question is, are there any skincare products or ingredients that need to be avoided during pregnancy other than retinoids?
Well, I think there's probably some. So that's more of a question for your obstetrician. I'm very conservative when it comes to using things during pregnancy that I'm not, absolutely sure about. So most of the botanicals won't be a problem. There might be some actives that are in some of the products that might be an issue. Lightening agents like hydroxyquinone may be an issue in pregnancy. Certainly the retinoids are something to be completely avoided. They have very well-known teratogenic effects. So things that can negatively affect the fetus. So definitely stay away from the vitamin A analogs like that. Mm-hmm. But that's something I would definitely discuss with your obstetrician if you had questions about it.
This question is going back to the surgical treatment for under eye bags. The question is, how much is the surgery?
Well, it's variable as to how much you're doing. So I would say a range. I don't know.
I think it's
Between-
highly individual.
It's individual, but I mean, I'd say it probably starts as low as $3,000, you know, for
Yeah.
the surgical
We
procedure.
would have to do an individual
Somewhere around
assessment.
there. And depending on how much you're getting done. So chemical peel would add a little bit to that.
Mhm.
So there's always, and it's a personal thing. I mean, I really like to talk about individuals when I'm talking about what we want to do to them, because everybody's a little different. Somewhere in that range, though. Anything else?
We'll do one more question. How often do you have to get face tight or body tight?
So it usually is, it's a one and done type of procedure. So, you know, it's not that you won't eventually show additional signs of aging, but it's pretty good at fat removal, and it's a pretty permanent thing. Certainly you can gain weight, and it might gain some weight in that area as well. Facial aging continues to occur, but most of the time they say that the results persist for a good 2 to 5 years. So it's not something, it's not quite like a facelift, which a modern facelift should have lasting effects for about 8 to 10 years. But it's a very good smaller procedure that can be not quite as effective, but also last a good long time. So I would say I haven't really done repeat procedures on those in the 2 or 2.5 years that we've used the device. So it's something that is generally one and done.
All right, I believe that's all the questions that we have. Thank you so much for doing this presentation.
All right. Thank you very much for being with us.
Yes, thank you everyone for joining us, and keep a lookout on tanner.org for classes in the future. Everyone have a great evening.
Okay, good night.